Go ahead.
Good morning, Dr. Tom here, and I'm here with a very, very dear friend of mine, an old colleague, Dr. Russel Cooper. This gentleman I love to death. I met him over 20 years ago in Hobart, Tasmania, and immediately clicked with this guy. This is the first time I've seen him in more than 20 years. And I run into him out of the blue, not in Australia, but here in California at the first ever conference on EMF toxicity. Wow. So the question I have for Russel, Dr. Cooper, is what brought you from Hobart, Australia to California for this particular conference?
Well, firstly, Tom, thank you. It's amazing to see you.
Yes.
Brother. What brought me? Well, we're in the midst of a crisis, a world crisis, where we are all being duped into believing what is happening with technology is safe, and it's far from it. It's incredibly dangerous, both for us and for our kids, and something substantial needs to be done to curtail this insidious danger, this radiation danger that we can't see it, we can't smell it, we can't hear it, but it's affecting us. But this is non-ionizing radiation, and we're told by the authorities that it's within the public standard, and therefore it's safe, and it should be of no harm to your health, and it's quite the opposite. People are becoming incredibly unhealthy in Australia and likewise in the US. People are getting a whole range of diseases, mainly neurological, but also extreme fatigue, problems with fertility. I mean, we know about airline pilots and people that work, stewards and people that work in that industry are far more prone to problems with fertility. But as we move into the 5G era, animals are being affected. Bees can't fly, they can't find the magnometer, their homing in device is being affected by the 5G millimeter waves. But we've had some fantastic success in Australia in that we've been able to, with a very smart and caring barrister who's working, I'm working with him, he really invited me to come and work with him, and we use a legal and medical approach. And this has worked very, very well in Australia. We've actually managed to reverse 900 small cell facilities have been taken out, and 1,600 facilities that are planned to go up, the planning has stopped because of this medical and legal approach.
So let me just regroup on some of this, because what you just said, there's a lot of items there. And first of all, you know, one of the things that I love about you, both as a brother and a physician, is your attention not only to your patients, but also to the community in which you live. And I believe that that's an essential value for all good physicians to have. And you mentioned, and when my practice was in Hawaii, I invented, if you will, a new syndrome called travel-related immune activity disorder, and I saw it in both the visitors and in the airline pilots and the flight attendants, because they were essentially, to get to Hawaii, they would be in an aluminum box at 28,000 feet for a minimum of 6 hours. And that's the gamma ray radiation penetrating that box, or that was amplified by that aluminum box of the plane, was causing immune activity disorders.
Correct, but there's also the radio frequency within the plane.
Yes.
I once was about to take off in Melbourne, but I was the first person on the plane with my little meter, my EMF meter, and this was a milligauss meter picking up the magnetic energy, and the magnetic fields were way over the scale with the plane essentially turned off. So not only are we exposed to magnetic fields and then fields, radio frequency, electromagnetic radiation, but we're also exposed to electric fields. So this is in the plane as well as cosmic radiation from outside the plane. So flying is a very unhealthy activity, no doubt about it.
So most of us are aware of the dangers of radiation from X-rays, and then whether we're medical professionals or not, and putting on these big lead gowns. But what we're really talking about this weekend is this thing called non-ionizing radiation, non-thermal radiation, and we're really talking about the 3G, the 4G, the 5G, cell phones, and digital devices.
Correct.
And so, as a physician, I've been gaining increasing awareness about this, and certainly we have patients coming into our clinic every month that say, I put the cell phone to my ear and my ear starts hurting, or I go into a big box store that has all these fluorescent lights and I start getting palpitations. Or I can remember when I got a new cell phone, and it was one of the phones that had a lot of battery problems, and I developed a dermatitis on my thigh underneath the pocket where I kept it on, and interestingly, soon after it developed on one side, it mirrored on the other, and I wasn't changing back and forth. It was obviously a neurologic phenomenon within my body. But now we're seeing this association with brain tumors, we're seeing an association with childhood leukemias, we're seeing association with breast cancer, women putting it in their bras, and then there are all these other effects, like you said, like the fatigue, or these things that we could blame a lot of different causes on. But there's also been research on who's most vulnerable. So in your practice, tell me about who you see that is most vulnerable with the worst pathologies.
Well, I normally see my electromagnetically hypersensitive patients usually come from a chronic fatigue background. Chronic fatigue, fibromyalgia, mold, mycotoxins, sort of Lyme. So all of these being put together under the banner of like neurasthenia, fatigue, exhaustion, cognitive problems, adrenal dysfunction. But most importantly of all, would appear their immune system has shunted from a strong immune system that can fight viruses, bacteria, fungal infections, to a more pro-allergic T helper 2 lymphocyte-dominated immune function, where they start releasing chemicals that allow the mast cells to release these very allergic-like substances, which causes rashes and itchings, but also causes brain inflammation and oxidation. And we now have markers in Australia developed by Professor Belpomme in France of markers of electromagnetic hypersensitivity. And these are markers that are the inflammatory and pro-oxidative markers in the brain, so it's showing oxidative damage to protein structures in the brain. It's called the nitrotyrosine marker. We can also look at blood-brain barrier permeability, and also heat shock proteins that are homeostatic proteins to try and balance oxidative events. So we have these wonderful markers. We can also look at a standard blood IgE blood test, as well as a full blood count, a histamine level, and a vitamin D level, and a C-reactive protein. So these are all the new markers which are surprisingly closely related to somebody who's sensitive to electromagnetic radiation.
So those of us that are parents, whether we're healthcare providers or not, we certainly have this concern about our children and their screen time and their tablet time, and we, in our schools, in my geo bubble, I'm seeing an epidemic of kids on medications in order to keep their focus, keep their attention, and also chronic sleep disorder and behavioral isolationism. And it's always a question for parents: is this a cultural phenomenon within this age group, or is it something that's coming about from computer games or from the radiation itself? So to tease this out scientifically, you're using monitoring with meters, yes? Yeah. And you mentioned that the monitoring levels that you're finding by doing objective meter monitoring are beyond the standards that are published by the industry.
Yeah, well, sometimes, let's qualify that. It may be within the standard, when you measure somebody's home, but they get affected within the standard. So my mantra with my patients who are affected is they are being affected within the standard, so therefore we have a problem. So a standard is set, but it's a standard that's way above and beyond what human health can tolerate. And I'm seeing increasingly more people getting sick within the very standard that is set to protect us. So in other words, it doesn't protect us.
Yes, and we've seen other cases of where standards set by government have been changed, like in the United States.
Correct.
EPA levels of clean water or of mercury are changed according to the political climate at the time.
Correct. So if you're a worker, you're allowed to be exposed to more lead than someone who's not a worker in the lead industry.
When none of us should have any lead in our body at all. That would be healthy. So the onus then becomes on the individual to actually get a monitor.
Well, to get a monitor, and most importantly, to keep your kids as far away from electronics as possible, to get Wi-Fi out of your home, to hardwire everything. It's amazing. It's like a re-education, starting from scratch.
Yes.
To keep your phone as far away from you as possible, to keep it in a protective case. To try never to wear it on your body, to always, like, it's easy for women because they can put it in the bag. For us it's harder, but it's probably safer holding it in a case in your hand than having it on your body. You know, when you look at the product information of smartphones, they should never touch the body. They should be 16 millimeters away from the body, which means the phone should never touch your ear. Never, ever. There's a most definite heating effect, even though we're told there's not. And if you have heating and if you have a sign of irritation in your ear, that is not good. So the phone should always be on speaker. A mistake that I see a lot of people making is they'll put the phone on speaker, but they'll hold it really close to their face. So you're actually getting zapped as much, if not more, than holding it to your ear. So the phone should always be a minimum, almost the arm at right angles with the phone on speaker, a minimum of 8 inches away from the body.
So we have the ability to get monitors, and we probably should inform people on what are the appropriate monitors. We have personal behavioral changes and the struggle between our own convenience or our own desires and what would be a healthy behavior. But what is unbelievable to me is you said that you've taken down in Australia through your efforts with the lawyer that you're working with, over 900 towers. I haven't heard in the United States of this, of being able to reverse and install towers.
Well, the Australian legal system protects individuals. So in your appointed place of residence, you're entitled to peace and sanctity, and anything other than that coming like from your next door neighbor is seen as a nuisance initially, and then an assault on your peace and privacy. And so legally, if somebody is assaulting you, the authorities can stop it. So my barrister has very cleverly put this together in a very compassionate way, uses me to do the medical advice for the patient, that I believe they are under extreme risk of harm to their health. And it's worked a treat.
So an analogy would be if I have a house and my neighbor is burning trash in their backyard and the smell is coming into my property, that's a nuisance. But if they're burning something that is toxic or carcinogenic and it's giving me asthma, then that's now an insult.
Well, that could be an assault.
An assault.
Assault. But more importantly, in Australian law, radio frequency is considered a pollutant. So when a tower is put up in your vicinity, that's non-consensual. You didn't agree to that. And you are being polluted by the unseen, unsmelt, unheard radiation, which could be affecting your original home.
So if we raise our awareness through monitoring, we struggle with our own personal behavior, but we hold this in this analogy of this is an unseen pollutant that we can then begin to visualize with these monitors. We can begin to get some perspective on this.
But more importantly, you must get a building biologist who's a professional. So of course we can do our own readings just to get an idea, a rough idea, but the building biologists, the data that they provide will hold weight if it ever needs to be used legally, because then you're seeing this is what I'm exposed to within the standard, but then there are safety standards by the many organizations like the Austrian Medical Association, who are the first medical organization that have very powerfully told us what is safe and what is unsafe, and this is thousands of times below the American standard and the European standard and the Australian standard. And then the Bi-Initiative group of specialist doctors from mainly America and Canada, who've put together their standard, which is very much in line with the Austrian standard, and then the European Environmental Association of Doctors, who have a similar standard, and they all the medical standards are very, very similar, so they thousands, actually millions of times below the current standard. And these are standards of safety that we should adhere to.
Well, this is a monumentous thing to undertake, and ultimately where we have big business versus individual sanctity or individual rights, it's usually it's follow the money trail for me, and how do we get traction so that we have a win-win both for the industry and for the person? And in Australia, you all have laws that are, as you said, protecting the individual right to peace and sanctity. I would have to get a good lawyer like you have to advise me, because we're having a lot of conversations this weekend about where do we get traction, where do we get on an insertion point, where's the greatest pain point for the public, or the greatest pain point for the deep pockets that are funding all of this. And so I invite all of you to join me in that conversation, and join me in that efforts to protect those who are most vulnerable in our families and our loved ones, our children, the elderly, and then some people that are just genetically predisposed for this.
So the standard should be based on protecting the most vulnerable in society, because once they're safe, we're safe.
Well, Russell, thank you so much for your time. Thank you so much for your wisdom. Your work is absolutely inspiring to me, and I hope it is to you as well. Well done.